Hi, this is Dr. A from Abbracci. I'm going to be talking about Kybella, our new favorite product today. This is a product that we're using for submental fullness, or like people call it in the street, the double chin. And so basically, it's an alternative to liposuction and surgery, no downtime, very predictable results, no complications or any problems so far at Abbracci, knock on wood. And I'll be answering a lot of the common questions that we have about Kybella, the side effects, who needs Kybella, who shouldn't have Kybella, and we'll be listening to your feedback and answering any other questions that people have. So, what is Kybella? Kybella is a product that's FDA-approved, naturally destroys fat cells or adipose tissue, adipose cells, using injection techniques versus making an incision and doing actual liposuction and removing the cells. Through these injections, the body naturally absorbs it and tightens up this submental fullness, or this submental area, actually killing the cells. So it's not like laser hair removal where after 5-10 years you may get regrowth of the hair cycle. These cells are dead, and once they're treated, you don't need to go back and get a second treatment after your series of treatments. So this is what Kybella comes in. It's this neat purple-red box. You open it up, and there are 4 2cc vials here, which we draw up the Kybella from. This is basically enough for 1 treatment or 2 treatments in people. So on the first treatment day, once you've had your consultation, and we decide that you're a good candidate for Kybella, not too little fat here, not too much, just the right amount, that you're safe and meet all the criteria, we go ahead and make you an appointment, and you'll need anywhere from 2 to 4 Kybella vials for your first treatment. 2 vials is kind of towards the lower end, 4 if you really have a lot of fullness here, and you'll be needing anywhere from 2 to 4 treatments on average. In general, you'll start to see results after the second treatment, which we do about 6 weeks apart. Allergan, who makes Kybella or Kythera, basically recommends every 4 weeks for treatment. However, we're seeing that results tend to take about 6 weeks, 4 to 6 weeks after the first treatment. So we wait 6 weeks after your first one, and then you do the second treatment, usually the same number of vials as your first treatment. So if you got 3 vials on the first day, you'll need probably 3 vials on the second treatment day. What to expect on the treatment day? Preparation actually takes longer than the actual injection. The actual injection can take less than 5 minutes on average. Basically, you'll come in, we'll make sure that there's no infection or any cellulitis or anything that we shouldn't be injecting through on the submental or chin area. We'll prep it with our cleanse here, with our HIBA cleanse, and then we'll take some of our specially formulated numbing cream, numb you up, wait for it to get nice and numb, wipe that off, clean you off again, and then put our nice little marking grid on the area to make sure that it's nice and clean and well marked. We go through all the different anatomical regions, making sure to miss your marginal mandibular nerve, your thyroid. You never want to inject a thyroid. And then basically making sure we miss the nerve, making sure we're in the fat zone on the anterior border of the sternocleidomastoid, and go through and inject really safely and quickly before we get that burn. At Abbracci, myself and Dr. Vernus, the other injector, have found that the burning or the discomfort starts about 2 to 3 minutes after the first injection, or after you inject the site, after the series of injections here. And so we try to ice, inject quickly and safely, and then once you start to feel that burn, we're icing and making sure that you're comfortable and talking about what to expect. Sometimes we'll do nerve blocks or numb the whole area with injections, but again, every single treatment with every single patient is individualized to your own anatomy and your own preferences. What we're seeing is about 60-40 women to men as far as the consultations and treatments that we see here in the office, safe for both, and as long as you're not allergic, you're not sick otherwise, there's no infection here, it's actually pretty safe medication to use. Predictable side effects include numbing, burning, pain at the injection sites. We tell everyone it's going to burn. You might feel numb for a few days. After about 1 to 2 days of injection, you'll get a little bit of laxity, which clears up pretty quickly, and your body will absorb it and bring it back up. So we try not to have date nights or big events right after the injection day. And then basically 1 to 2 to 3 weeks after, expect some redness, burning, numbness, which will go away. You can take ibuprofen, Tylenol, over-the-counter medications, ice, and we're always available for any questions in between. But expect it to be uncomfortable, and we'll be showing you before and afters in upcoming specials about Kybella for our clients, and our other medical director, Dr. Vernus, who actually got Kybella. So we're excited to show you his second treatment. So stay tuned, send in your questions, happy to answer them. We're really excited about Kybella, and thank you for watching. Take care.